These expectant mothers are worried. They live in a refugee camp in Diffa in southern Niger, which is at the centre of a hepatitis E epidemic. The World Health Organization says pregnant women who contract the disease are more prone to liver failure. Doctors Without Borders says the outbreak is linked to water shortages and poor sanitation in refugee camps.
This epidemic was declared by the government 2 weeks ago, but it's still very much a crisis. We are working with the government to put in place emergency measures. They include chlorinating water, treating water containers and distributing soap. We hope these measures will eventually result in people having clean drinking water.
Hepatitis E is a liver disease caused by a virus. It's transmitted through drinking water contaminated with sewage. Symptoms include fever, headache, vomiting and abdominal pain. The refugee camps are in the Lake Chad basin where Boko Haram fighters are active. Niger Government forces are involved in an offensive with neighbouring countries to defeat the armed group based in Nigeria. The fighting has forced 300,000 people from their homes. They're sheltering in refugee camps in Diffa, but there's not been enough clean water to go around. The UN says it's urgently working to improve the cleanliness of the water supply.
There have been over 100 cases declared and unfortunately over 25 deaths. So we're working very closely with the government, with the World Health Organization and partners to put in place activities in terms of WASH to ensure access to clean drinking water and medication for health centres and to communicate with the population in terms of avoiding the disease prevention.
Government leaders in Niger say the epidemic is under control. But the rainy season is due to start and doctors say wet conditions will cause the disease to spread further. Victoria Gatenby, Al Jazeera.